A patient with chronic heart failure presents with dyspnea, weight gain, and edema. Which nursing intervention is most appropriate first? A. Administer 4-furosemide as ordered. B. Restrict fluid intake immediately. C. Obtain daily weight and assess lung sounds. D. Encourage high-sodium diet. Answer: C. The priority for a patient with worsening heart failure is thorough assessment, including daily weight and lung sounds, to evaluate fluid status before initiating interventions like diuretics. Nursing interventions must be guided by current patient data to prevent complications such as hypotension or electrolyte imbalance. A patient reports taking a new antihypertensive medication and experiences dizziness upon standing. What is the most important nursing action? A. Encourage the patient to continue medication. B. Teach the patient to rise slowly from sitting or lying positions. C. Immediately discontinue the medication. D. Advise the patient to increase sodium intake. Answer: B. Dizziness upon standing indicates orthostatic hypotension, a common side effect of antihypertensives. Nurses should educate patients to rise slowly to prevent falls. This intervention addresses patient safety while maintaining therapeutic efficacy. A client with type 1 diabetes has blood glucose of 58 mg per deciliter. Which action should the nurse take first? A. Administer regular insulin. B. Provide 15 g of fast-acting carbohydrate. C. Encourage the client to exercise. D. Notify the healthcare provider. Answer: B. Hypoglycemia, less than 70 mg per deciliter, requires immediate treatment with fast-acting carbohydrates to prevent neuroglycopenic symptoms. Administering insulin or exercise would worsen hypoglycemia. This scenario tests recognition and immediate intervention for critical lab values. A patient is receiving a blood transfusion and develops urticaria and pruritus. What is the most appropriate initial nursing action? A. Stop the transfusion and notify the provider. B. Slow the transfusion rate and continue. C. Administer epinephrine IM immediately. D. Apply cold packs to the skin. Answer: A. Allergic reactions to transfusions require immediate cessation of the infusion and provider notification. Continuing the transfusion could escalate the reaction, and interventions like epinephrine are reserved for severe anaphylaxis. A nurse is caring for a patient on warfarin. The patient reports black, tarry stools. What is the priority nursing action? A. Document the finding in the chart. B. Assess vital signs and notify the provider. C. Encourage iron-rich foods. D. Teach about stool color changes. Answer: B. Black, tarry stools indicate possible gastrointestinal bleeding, a serious adverse effect of anticoagulants. Immediate assessment and provider notification are necessary to prevent hemorrhagic complications. Documentation alone is insufficient. A client is prescribed a new opioid analgesic and reports constipation. Which intervention is best? A. Increase dietary fiber and fluid intake. B. Encourage immobility to prevent strain. C. Stop the opioid immediately. D. Administer a high-fat diet. Answer: A. Opioids commonly cause constipation. Nursing management includes increasing dietary fiber, fluids, and activity, possibly adding stool softeners. Abruptly stopping medication could cause withdrawal, and high-fat diets exacerbate constipation. A patient is admitted with acute asthma exacerbation. Which assessment finding requires immediate intervention? A. Mild wheezing on auscultation. B. Respiratory rate of 28 per minute with accessory muscle use. C. SpO2 95% on room air. D. Occasional coughing. Answer: B. Use of accessory muscles and tachypnea indicates severe respiratory distress and potential impending respiratory failure. Immediate interventions, such as bronchodilators or oxygen therapy, are required. Mild wheezing or SpO2 95% is not immediately critical. A nurse is caring for a patient with a nasogastric tube. The tube becomes dislodged. What is the priority nursing action? A. Reinsert the tube immediately. B. Notify the provider and keep the tube site covered. C. Flush the tube with water. D. Document the incident and continue care. Answer, B. Dislodged NG tubes pose risks of aspiration and inaccurate medication delivery. The nurse should notify the provider and maintain site hygiene while monitoring the patient. Immediate reinsertion should only occur after provider approval. A patient with pneumonia has a temperature of 102.4 degrees Fahrenheit, increased WBC, and productive cough. Which nursing intervention is most appropriate? A. Encourage bed rest only. B. Administer antibiotics as prescribed and provide supportive care. C. Withhold medications until WBC normalizes. D. Encourage high-fat diet to maintain calories. Answer, B. Pneumonia requires timely administration of prescribed antibiotics and supportive care including hydration, oxygen if needed, and monitoring. Delay in treatment can worsen infection and increase risk of sepsis. A patient is receiving 4 vancomycin and reports flushing and itching in the upper body. What is the best nursing action? A. Slow the infusion rate and monitor the patient. B. Stop the infusion and notify the provider immediately. C. Administer acetaminophen. D. Document and continue infusion. Answer, B. The patient may be experiencing red man syndrome, a reaction to rapid vancomycin infusion. Immediate cessation and provider notification are necessary, as the reaction can escalate. Slowing the rate may be appropriate only after provider guidance. A nurse is administering digoxin and notes a pulse of 48 bpm in an adult patient. What is the most appropriate action? A. Administer the dose as prescribed. B. Hold the medication and notify the provider. C. Encourage patient to rest and then give the dose. D. Administer a double dose next time to compensate. Answer, B. Bradycardia, less than 60 bpm in adults, is a contraindication for digoxin administration. Holding the medication and notifying the provider prevents toxicity and potential cardiac complications. A patient reports sudden chest pain radiating to the left arm. What should the nurse do first? A. Administer nitroglycerin as prescribed. B. Call a code blue. C. Assess vital signs and obtain ECG. D. Encourage deep breathing exercises. Answer, C. Immediate assessment and ECG are crucial to confirm myocardial ischemia. Administering medications or calling code may follow, but proper assessment guides safe and effective intervention. A nurse is caring for a postoperative patient on PCA, patient-controlled analgesia. The patient's respiratory rate drops to 8 per minute. What is the priority intervention? A. Encourage patient to self-administer analgesia. B. Stop the PCA infusion and stimulate the patient. C. Administer additional analgesics. D. Document the finding and monitor. Answer, B. Respiratory depression is a life-threatening adverse effect of opioids. Immediate cessation of PCA and stimulation of the patient is necessary, followed by provider notification. Documentation alone is insufficient.